Joining us now, Matthew and Dale Bellis from Liberty HealthShare. Dale, the longtime executive director and the founder of Liberty HealthShare, getting set to retire, turning over his company to Matthew Bellis. So this is like a transition of jurisdiction. Matthew, Dale, great to have you with us on the John Fredericks Radio Network.
Well, I'm happy to be here, John. Thanks for the invitation.
Okay, so Matthew, you're on too. Okay, let's start with the Indians, and then we'll go to HealthShare because I know you're big Cleveland fans. So listen, I think you guys got your hands full with these Twins. You know, I'm an Astros fan. They just beat us 2 out of 3 in Minnesota. I think you guys got your hands full.
Well, we've got our hands full without a doubt. Pardon me, with Kluber being taken out of the game after being hit by a line drive. It's really interesting to see all of the aftermath of that, and we'll see how they make out. But there's certainly a challenge, and I would have to say, Matt, living in Lancaster, PA, not far from Philly, has different attractions to different baseball and sports teams than I.
So, Matt, you're, $330 million player, whatever he's hitting .093. What do you think of that?
No, he's not my player. I'm actually a Pittsburgh Steelers fan and a Pirates fan, so go Bucks. Okay, well, I like the Pirates. They've got the best, I tell you what, they've got the best relief pitching right now, except for the Astros, I think, in the major league, certainly the best in the National League. But every time I see Harper hitting .093 and the Philly fans booing him mercilessly, I just have to say I laugh. I really do. $330 million. Those are the same fans that threw snowballs at Santa Claus, so we'll have to let that one slide.
They did throw snowballs at Santa Claus. Okay, let's talk about Liberty HealthShare, guys. So happy to have you on. You know, I love your company. You've been a lifesaver for me. My wife and I we own a small business, and when Obamacare first came out, our insurance by our carrier was dropped, and we had to pay $1,000 a month, which I didn't have. I was paying like $500, and my deductible was $10,000. And if I didn't pay it, I had to pay a fine. So basically, I didn't have insurance, and my wife independently went out and said, I got to solve this for our family. She found LHS, talked to you guys, and the story goes on from there. We've been with you now on an 8-year period. I got to tell you this other story. Just 2 quick stories, guys. Bear with me. So my son, I've got 3 children. My oldest son is now out of the house. He's a college professor at Ole Miss, and he went on Liberty HealthShare when he was a college professor at the University of Nevada. And I'm like, why don't you just take the health care that they have at the university? And he says, because it's a hassle. I can only get this doctor, that doctor, this. I got to fill all this paperwork. They take money out of my check. So he went to you guys. So he rejected institutional care for LHS. Then he goes back to Ole Miss, where he has his degrees to teach. Same thing. And so he's still with LHS. So he rejected the institutional care from a state institution in favor of Liberty because he said, I don't pay as much money. I get to see the doctor I want. It's like paying cash. I like putting into the system where I can help other people, and I'm out of the rat race. So now what we're doing is we're offering, as a small company, we never had the ability to offer insurance to our staff. Now we're offering it in the form of Liberty HealthShare. So now we have an employee plan, which has been helping us attract better employees like Kiara, who's with us now. So that's how we've evolved. I mean, am I the only person who's saying this, guys?
It is a nationwide movement, John, of people deciding it's time to drop out of the third-party health insurance arrangements and instead employ time-tested principles of person helping person, neighbor helping neighbor, and that's the way we pay each other's medical bills. It's just employing that simple principle that we're here for each other, in community, paying each other's bills. We're not insurance, don't want to be. We want to unleash the power of the individual's choice and the power as a consumer in seeking out and receiving health care. And that's why it's such a powerful movement across America.
Let me ask you something. Let's go to Matt. Matt, we've got a transition here. Your father started, he founded Liberty HealthShare. It's grown substantially. Tell us about any changes that are going to be made as you basically evolve into the leadership role.
Well, we're going to stay with the same desires that we've had in the beginning. We're going to be working to provide folks with the greatest care possible for the lowest cost. We're going to bring, as many people who want to share in medical bills together. It's about that mindset that we as a group, a community of people who are sharing medical bills together, that's not going away. And you'll be seeing things from our new CEO that is going to bring about some more operational efficiencies, some more individualized systems so that people can manage their health care better. So we're going to be making improvements and not changing what's working.
Well, that's a great thing because it is working. And I want to get, Dale, let's go back to you. Let's get your thoughts here on the Democrats' proposal to go to Medicare for all. And one of the things that you said earlier, Dale, is so right. It's one thing, a lot of people that have gone to your company have done it from need, like they can't afford the other insurance, or they're an independent contractor, they work in the gig economy, their company doesn't offer things like that, or they're small business people like me and you have to pay exorbitant rates and this service stinks, deductibles are too high, so you're an alternative. But I thought one of the greatest things was when my 29-year-old son opted out of a traditional system as a state employee, opted out of it to go to your independent network. I thought that was a telltale sign. And he did that on his own. I mean, he's an adult, does whatever he wants. I thought, how does this going to Medicare for all, how does that affect your overall growth?
There is a absolute difference of ideology here. And that's really the discussion we're going to have as a society and as a nation in terms of the role of federal government into the choices and selections about the care of our health. We posit that this is an area of personal and individualized freedom. We have the fundamental right as an individual to manage, direct, and care for our own health. And so it's really a contrast between intrusive government oversight and control of a healthcare system versus individual freedom. And that's really our thrust, that we have the choice and opportunity as individuals to select how we choose to not just simply access care, but pay for that care in a like-minded community.
So I just have to tell my listeners now, if you're unhappy with your insurance, you want to get out of the rat race like we did, now when you follow, like for me, when we follow Medicare for all or Bernie Sanders or Kamala Harris, whatever they're saying about canceling private insurance, I can cover it, but it has no impact on me because whatever happens to it, I've got my own separate way to care for my family, which is outside of the rat race, outside of the system, doesn't impact me at all. So it really takes on a different view. So if you'd like more information, here's what to do. Go to libertyhealthshare.org. That's libertyhealthshare.org. It's a movement. You can ask for a quotation. You're going to be shocked when you get it back. or you can call 855-585-4237, 855-585-4237. And I'm telling you, you get on this thing for 90 days, you'll never go back. You'll never change back to the old way. This is just so much better, so much cleaner, and so much cheaper. I mean, that's the other thing. It's cost less and the service is better. You pick the doctor you want, the hospital you want. You're completely empowered, and you know where your money is going. That's the big difference with it. Dale, so you've built Liberty HealthShare from an idea to what it is today. Why are you retiring, Dale? You're too young to retire.
Well, I am coming to that point in my life when just making those choices and decisions about the future and expanding this movement. It's time to just simply give it to the young bucks who are motivated to just really grow it from an entrepreneurial startup to a large national movement. And I'm just hopefully wise enough to believe that there are those coming up behind me who are better equipped and more skillful in terms of expanding it and making it even a larger impact and larger movement.
Matthew, taking the company over, what is your number one vision? Like, what do you really want to do in, say, the next 5 years?
Well, really, the desire is to bring about greater control to the individual self-pay patient, our individual member, provide them with the resources and tools to make better, wiser decisions. It's only whenever we have proper information that we're able to make wise decisions, because the individual self-pay patient is our little-known secret within the healthcare world. That's where all of the cost containment, cost savings, freedom, availability, that's where it all lies. And so we're investing heavily in that, in the individual, to make sure that this whole process is able to continue.
I tell you what, I'm really excited about what you guys have done. You've made a big impact on myself and my family in our time of need, and we just couldn't be happier with what you guys have done. And I really get excited when I go to like CPAC and other events where you guys are front and center, and so many people are talking about it, because it's hard. I mean, to start the concept you guys did at the time you did it, basically it was an idea, and have it grow to the state it is now, and the growth has been organic. It's not like you guys have spent, millions of dollars in advertising. It's been organic, and it's been word of mouth, and that's why it's been so effective, because the way you promote yourself is the same way it works. It's person to person, people helping other people. It's really been a godsend for me, guys, and thank you.
And our thanks to you, John. God bless you.
And now we're offering
Thank you,
it.
John.
And guys, look, now we're offering it to our employees. That's another thing. If you're a small business out there, the job market is tightening, right? You're trying to find good people. And one of the disadvantages that a small business has is people say, do you have insurance? No, right? That's your standard answer. So you got to go and get it on your own. Now with LHS, you have the ability as a small business owner, as an employer, to now be able to offer your employees coverage through the Liberty HealthShare plan. And so it becomes affordable. And that's a whole new opportunity you've given guys, small businesses like me, in order to be more competitive in finding the best people. Is that part of your business you're seeing start to grow?
Well, anything that disperses from centralization to the power of individual choice, not only is that a principle that's made America great, it's really the answer to controlling costs and providing access for health care. And that's the movement here. It is simply, as Matt said moments ago, it's empowering the individual patient, their choices, and putting tools in their hands to make decisions that's in their individual self-interests. And that's really the power behind Liberty HealthShare as a healthcare sharing movement.
All right, Matt, Bellis, good luck in your leadership with the company. Dale, we'll be seeing more of each other now that you're retired. We can talk baseball more. I want to thank Dale and Matt Bellis for being with us. More information, go to libertyhealthshare.org, libertyhealthshare.org, 855-585-4237.